Welcome. I'm Dr. Nishi Bhopal, a physician specializing in integrative psychiatry and sleep medicine. And before we jump in, I'd like to invite you to subscribe to this channel, which is all about sleep and mental health. Healthcare practitioners can also receive CME credits for watching these videos. Today, I'm delighted to be joined by my colleague, Dr. Audrey Wells. We'll be talking about helping your patients adjust to CPAP. Dr. Wells is a sleep medicine physician and certified mindset coach, on a mission to help people sleep better so they can feel more awake and alive all day long. She offers a group coaching program and a private Facebook community for those struggling with sleep apnea and treatment, including CPAP and CPAP alternatives. She also does individual coaching for those who want to uplevel their productivity and potential by taking too tired out of the equation. So Audrey, I'm really excited to chat with you today because CPAP is kind of misunderstood. A lot of people use it. A lot of people struggle with it. Even physicians, struggle with helping their patients adjust to it. And it is the gold standard treatment for sleep apnea.
Yes.
But, many people just find it really uncomfortable. So I think it's great that this is kind of your mission to help people adjust to it, because it really can be life-changing. But before we get into that, I'd love to hear more about why you became interested in sleep medicine and your experiences with that.
Sure. Yeah, thanks for having me today, Nishi. I'm really just happy to talk about this and kind of address some questions that I'm sure come up in your world as well as mine. So for me, the journey to sleep medicine was sort of a tangential one. I was actually in my pulmonary medicine fellowship when I discovered that sleep medicine was a thing. And I remember the day. It was one of those revelation moments that sometimes we get in our lives. And I just felt really called to that area because I have suffered when I don't sleep. And, in my life, it's been a real problem if I can't get enough sleep. I notice the effects immediately, and I've become really familiar with what my own parameters are. So it was very natural for me to go into sleep medicine as a specialty because I feel driven to help others too.
It's so interesting. I remember when I first found out that sleep medicine was a specialty as well. It was kind of a pivotal moment.
Yeah. Even now I get folks asking me like, sleep medicine, that's a thing?
Right.
Like, yes.
Yeah, it is a thing. And it's life-changing. And, everybody needs to sleep. So it's relevant to every single person.
True. So true.
So let's talk today about sleep apnea. I mean, there's so many aspects of sleep we could dive into, but we'll focus on sleep apnea. And I know that's one of your areas of specialty.
Yes.
And then we'll talk about CPAP and treatments of sleep apnea as well. But just for our audience, for whoever's listening, we've got physicians, we've got non-physicians. What is obstructive sleep apnea and why is it important to know about?
Yeah. So I like to tell people that obstructive sleep apnea is first and foremost a breathing disorder. And I underscore that a little bit because usually when you think about a breathing disorder, you really want that treated. And when you talk about things that occur during sleep, in our sort of collective awareness, the disorders of sleep can get discounted because when you're asleep, you're unconscious. And it's only very recently that we've sort of been able to recognize what sleep problems have as an effect in our lives. So obstructive sleep apnea is a breathing disorder. It occurs when the muscles in the back of the throat relax during sleep, and the patency of the airway gets compromised. So normally there's a little bit of this anyway for folks who don't have sleep apnea, but you kind of cross a threshold when that throat closure happens, and that impairs the air from entering the lungs, which means your blood oxygen levels dip. And compared to holding your breath for the same amount of time while you're awake, those dips in blood oxygen during sleep can be quite profound. And we're talking 10%, 20%, 30% dips from baseline during sleep. So when that occurs, the brain is finally triggered to awaken because that drop in your blood oxygen level is a red flag. So the body has a sympathetic response, that fight or flight. response that causes an awakening, so you can gasp by re-engaging those throat muscles and take some recovery breaths. Unfortunately, when you return to sleep, that cycle can repeat itself over and over. And that's actually one of the ways that we measure the severity of sleep apnea, is determining how many times is that cycle occurring per hour of sleep. So anything above 5 is considered pathologic. And then as that number increases, you start to accumulate more and more risk for the problems associated with sleep apnea.
That's really helpful to hear. And, for physicians who are listening, or even for lay people who are listening, so 5 to 15 is considered
mild sleep apnea. Mm-hmm.
And then 15 to 30
is moderate sleep apnea. Yeah, and we're talking per hour, not just over the course of the night. So, for example, if you have 30 airway obstructions per hour of sleep time, that means you're blocking your airway and having that drop in your blood oxygen and or a disruption to your sleep. Your brain wakes up every other minute. Sometimes I liken this to being in your bedroom and the smoke alarm is chirping and interrupting your sleep. How annoying would that be? And with sleep apnea, that's occurring every single night. So it's a real problem.
I love that analogy of the chirping of the smoke alarm. Yeah, because you're getting these continual disturbances of sleep because of these breathing events. Mm-hmm. So what's the big deal? Like, why is it important to treat this? So you're not, breathing well at night, you wake up, you go back to sleep. What's the problem?
Yeah. So the sleep disruption is one part. And a lot of times that's what leads people to seek care, because the night becomes very long. All of these awakenings sort of add up to sleep disruption. Some of the awakenings are to full consciousness, and you may have trouble getting back to sleep. But the majority of awakenings are not to full consciousness, even though they're interrupting your sleep cycle. So daytime sleepiness is really common. Problems with memory and concentration, irritability, sort of a depressed mood, all of these things are related to the sleep disruption. There's another problem, though, which is related to the breathing problem. So with the drops in blood oxygen and then the reoxygenation as a person recovers their breathing, what happens in the body physiologically is an inflammatory response. And that inflammatory response is what causes the health problems associated with sleep apnea. So we're talking higher risk of heart attack and stroke, trouble controlling blood pressure, trouble controlling diabetes or risk for diabetes. All of these things are associated with that deoxygenation, reoxygenation cycle. So between that and the arousal, you're really having unhealthy sleep.
And so, as you just illustrated, this is a significant problem.
Yes.
It can cause multiple downstream issues. As you mentioned, metabolic issues, cardiovascular issues. I'm a psychiatrist, so I also see people who have mood issues from untreated sleep apnea, depression, anxiety, problems with concentration, brain fog, and so forth. But the good news is that this can be treated. And yes, and the gold standard treatment, as we were saying, is PAP therapy. So can you explain what that is?
Absolutely. Yeah, PAP therapy is several different varieties. So I want to start by saying PAP stands for positive airway pressure. Most commonly now, this takes the form of CPAP or auto PAP. C in CPAP is for continuous, and then in auto, it's auto positive airway pressure. And that's a nod to how the machine has the ability to ramp up or ramp down, depending on the airway obstructions, which that's related to body position or sleep stage most of the time. There's a few other types of PAP therapy, like BiPAP or ASV PAP, that are more advanced forms of air pressure delivery. But what all of these things have in common is that the air pressure is a gentle support for the airway during sleep, and it's multi-level support. And I want to mention this because it's something that separates PAP therapy from the alternatives to PAP therapy, okay? So when you think about the airway collapse, it can occur anywhere from sort of the back of the nasopharynx, kind of up here, all the way down to the epiglottis. And so that multi-level airway support is an advantage to PAP therapy or CPAP therapy, and that's why it's the gold standard treatment. There's no oxygen in CPAP typically. It's just the air you breathe. And there are a lot of different comfort measures that are available. For example, humidification is available, and that can be sort of dialed up or down. There's also pressure features that modern machines have so that you can make that pressure setting more easily tolerable to the person who's using it. Even a ramp feature that kind of gets you to sleep as the machine is ramping up to your therapeutic pressure. So all this to say, CPAP is multi-level airway support that can completely correct sleep apnea, but the caveat is you have to use it for it to be effective.
Like with anything, right? You have to
Yes.
practice it for it to work. So that's great. That's really helpful to hear how PAP works. So, I have a lot of patients who struggle with using PAP therapy. They hear, yeah, it's the gold standard. It's the best thing you can do to treat your sleep apnea. And then they start using it and they're like, I don't know if I can do this. So what are some of the most common challenges that you see with your patients and clients when it comes to PAP therapy?
Yeah. This is a big pain point for me as a sleep medicine doctor. And I think historically, we've been very good at diagnosing sleep apnea for anyone who comes to the clinic. I mean, I want to just take a side note here to say that about 80, 85, in some estimates, 90% of people with sleep apnea are undiagnosed, just to give you a sense of the burden that's out there. But for people who come to a sleep clinic, I think that sleep medicine as a collective is very good at finding sleep apnea. But getting folks treated effectively has fallen a bit short. And it's a shame because I think when a person seeks care, having this treatment opportunity is very seductive, right? Doesn't it sound fabulous to treat your sleep and to get better? So when they're diagnosed and then they have the CPAP, they're getting a lot of information. They're bringing a machine into their home, and sometimes there's some psychological barrier associated with that. And then there's also some physical considerations. So there's an acclimation process that happens with getting used to the mask on your face and getting used to that pressure sensation as you're trying to sleep. So issues with the thoughts and feelings about being diagnosed with sleep apnea is one barrier. And then I think the other issue is just the physical newness and acclimation to CPAP treatment.
That's really, really interesting, right? Because a lot of us don't think about the mindset piece when it comes to the treatment of the sleep apnea, at least, doctors in the sleep clinic. And I don't recall being trained in that when I was going through sleep medicine fellowship. And, as I mentioned, I'm a psychiatrist, so I kind of have that take anyways, but I know, it's not standard practice necessarily to talk about the mindset and the psychological aspects of adjusting to CPAP. So how do you help your patients? I know you see patients, you also have a coaching business where you see clients. So what are some of the methods that you bring into your treatment strategies?
Yeah. So I think as a physician, my frustration was the limitations that the healthcare delivery system puts on us. We have relatively short appointments, and access to a sleep medicine physician is quite limited. So I can see a person, every couple of months, maybe, but often my schedule books out for several months. And it's just not enough for someone who's struggling. So what I have created is an opportunity for support, and I want to say professional support outside of the clinic. And that's really what my coaching business is meant to do. So I see folks in a group setting to address a lot of issues that are very common when acclimating to CPAP or struggling with CPAP, to really make sure they're making an informed choice about whether CPAP is for them. It's a frustration of mine when people aren't getting the support they need, and they kind of feel like, well, that must mean CPAP is not for me, or I'm failing at treating my sleep apnea. But I beg to differ. I think if someone's willing to try and they're able to pair that with support and more education, then chances are much higher that they would be successful. And that's what I'm hoping to bring.
That's fantastic. It's so needed. I know you had a mask that maybe you could show, because one of the issues is, well, I mean, we were talking about mindset and that support, but I mean, the physicality of CPAP can be a barrier for people as well. And, one thing I tell my patients is that finding the right mask is like finding the right pair of shoes, right? So it might feel like it's okay in the store, but then you start wearing the shoes and they're pinching and they're rubbing and you didn't notice that in the store when you bought it. So finding a CPAP mask is like that. So could you speak a little bit about, finding the right mask, fitting masks, maybe if you have some examples to show, I think that would be helpful as well.
Definitely. Yeah. Sometimes if it's a woman I'm talking to, I'll say it's like finding the right bra. And that really helps the connection, because it's like, oh my gosh. Okay. Yes. So you may have had this too. When folks say like, oh, am I going to get the mask? Do they do this? Like the mask?
They do. Right? The dark.
And what they're talking about is the nose and the mouth mask, which is the biggest type. So I want to show this mask, which this is the smallest type of mask. This is called a nasal pillow mask, and there's another type called a nasal cradle. But and this is the headgear, which just holds the mask in place so that the air pressure can be delivered. But the only part that's touching your face is right here, and this just goes on the inside of your nostrils to make that seal so that the air pressure is delivered into your nasal cavity and holding the throat open with that gentle support. And then the headgear sort of is like so. And this allows for people to move in bed and really is a lot less invasive. I do say that, if you're someone who likes to read in bed, a mask like this is better because it allows you to wear glasses. And for folks who have some anxiety at night or even a feeling of claustrophobia, the nasal pillow masks are much better, because opening your mouth when you start having some anxiety can be a lot of relief as you're getting used to the treatment.
Excellent. So what should physicians know about CPAP or PAP therapy in general, or what tips can they offer their patients?
Yeah. I think one of my missions in life is just to increase awareness of the possibility of sleep apnea among physicians. Really just having that on your radar for anybody with mood problems or weight problems or problems controlling their diabetes or their blood pressure. Having sleep apnea in your mind as a possible contributor to those conditions is super important. So doing some screening for that in the visit doesn't take much time and can just put it on the radar for the patient as well. And then I think where CPAP is concerned, knowing that it's the gold standard, knowing that there are a lot of different ways to make that treatment more comfortable, and encouraging folks to keep at it, to keep trying. I want to say something that I hope will be sort of also put into the common awareness, which is that there's this idea of compliance with CPAP. From an insurance perspective, we're talking about 4 hours of CPAP use, which is half of the time that you would reasonably be getting enough sleep. The issue with being compliant or minimally compliant is if a person is only getting that 4 hours with CPAP in place, the 4 hours in this usually the second half of the night where CPAP is not being used, they still have sleep apnea. And they have sleep apnea mostly during their REM sleep, which is super important for their functioning. And I think this is a little bit of a disservice. There's insurance compliance and then there's medical compliance. And I really try to help people shoot for using their CPAP throughout the entire night so that their entire sleep period can be covered.
That's really important. And as you mentioned, sleep apnea oftentimes, not always, but oftentimes is worse in REM sleep. And we get more of our REM sleep in the second half of the night. But that's usually by the time people rip their mask off and then they don't use it during the time where it's at its worst. So that's a really important distinction there between the insurance compliance and then the medical compliance. Okay, so what should people do if they're using CPAP, they're compliant, they found the mask, but they're still kind of struggling? What would you recommend?
Yeah, oftentimes there are some issues with anxiety before sleep, the bed dread, as a lot of people call it. If that's an issue, a lot of times what I'll recommend is using the mask before they even attempt sleep. So even several hours before, or using CPAP for maybe 20 minutes during a midday nap opportunity. Definitely no longer than 20 minutes, maybe 30 minutes, because you don't want to take away from your nighttime sleep. But just getting more experience with that can really help take the mind drama out of it. Another issue that I see is people who wake up in the middle of the night and they've just kind of had it with the CPAP mask. But if you wake up in the middle of the night, it can be hard to get back to sleep. So sometimes taking a break, which looks like taking your mask off and getting out of bed, just like getting out of bed if you can't go back to sleep, just take a break, go into another room, engage in a quiet activity, and then come back when you feel like there's a high chance that you would be able to go back to sleep. Put the mask back on, do deep breathing. There's a lot of things I take my clients through when it comes to getting back to sleep, because I think that's a pretty frustrating thing. If folks want to know more, they can find me at supersleepmd.com. There's ways to get in touch with me, and I'd be happy to help.
That's fantastic. Well, thank you, Dr. Audrey. So supersleepmd.com. We'll show the link on the screen here, and then we'll also have it in the video description underneath this video.
Great.
This was super helpful. I really appreciate you taking the time to speak with me today and share these tips. And just, I think a couple of big takeaways. One, for physicians, screen your patients for sleep apnea. Yeah. And then for people who are struggling with CPAP, there are lots of methods that you can do to help you adjust to it. So find more.
Keep trying.
Keep trying.
Keep trying.
Wonderful. And, for people who are watching, if you found this video helpful, please go ahead and click the like button and also subscribe to the channel to learn more about sleep medicine. Well, thanks, Dr. Audrey, for joining me.
Pleasure. Take good care.